The following program is a specialty program. Unless otherwise identified, the participants on the program are not employees of Chorus Entertainment. Opinions expressed may not necessarily reflect the views and policies of Global News Radio 640 Toronto.
Anybody calling in that's got any aches or pains anywhere, trying to sort of navigate the injury and figure out what's going on, the simplest way that this could all start with is a simple phone call. And the reality is none of these things are by any means unique to any individual, right? Like if you've got back pain, it means there's 80% of the population that's got, it doesn't, not that it means that, but I'm telling you that 80% of the population at some point will have back pain. So it's a relevant topic overall for the listeners. Knee pain, ankle pain. I just was speaking with somebody this morning, getting back outside, playing some basketball, rolled their ankle, was told to go get some physio, and sort of that was it, but wanted some advice on particularly what it would entail, what the type of treatment would be, and I was able to help that individual speak to them about the type of injury, what happens with those ankle sprains, what you've got to do, the progression of it, and again, that I think really the education and empowerment around any type of health issue consistently shows up in guidelines. You know, from a healthcare perspective, healthcare professionals often try to work based off of the clinical guidelines, like what is the best way to treat somebody and go about things. And patient education and empowerment is the number one thing that's always there. It really does do an incredible thing when you can give somebody a little bit of the knowledge that they need. Once you've come up with whatever the diagnosis is, and then you can educate them on, okay, what is this diagnosis? What does it mean? What's the prognosis like, particularly to them? You know, that's what they're going to care about most is how's it going to affect their lives? How likely are they to recover from it? And what is the overall progression of this? What stages do you have to go through? Can you get back to doing what you love to do? Anybody that's active, and you'll appreciate this, John, the minute they get hurt, the first thing they want to know is how long until how long until you can get back to what you're doing. And that's a very important thing, because you don't want to, stop doing the things that you love. And that's a big concern. In fact, that's one of the reasons why most people don't take any breaks with these types of injuries, is really because they just don't want to stop doing what they love to do. And I get that. Sometimes you do need to take a little bit of a break. And I think it was last week we had a call. I forget what the particular concern was, but I was talking to the individual. I sort of remember that it was someone who's very active doing something, and there's been no rest incorporated. And that's a very, that's a concerning thing, because you need to have a period of rest sometimes when you're hurt. Now, the beauty about this, and for anybody who's an active person listening will love to hear this, rest doesn't mean sit on the couch and do nothing. It's not, this isn't 1970 anymore, where if you had low back pain, they would tell you to lay in bed and, wait a week and don't leave your bed. That actually will make you much worse. Most musculoskeletal injuries, if they do require rest, they're going to require active rest. And so the question becomes, well, what is active rest? Active rest is a combination of doing the rehabilitation that you have to do and working back up. And sometimes, John, if you've got a shoulder injury, as an example, there's a lot of other things that you can work on where we can isolate that shoulder and not have that part of the game plan in terms of still being active, looking at the micro components of whatever it is that you're doing and seeing, okay, well, how can we just take that out of the equation right now, or how can we start to reintroduce it in a modified manner that's graded? That is all very, very important things that most people don't do. A lot of times they don't even get the advice to do it, which is a problem in and of itself. You've got to get that advice. Someone's got to sit there and tell you, you've got to be able to do something while you're sitting there and trying to recover. So, that's really, really important for people to understand that rest does not mean do nothing. Rest can often mean active rest in these, and it's also not for a prolonged period of time. A lot of the times, and that is again something that when you get this message across to somebody who's dealing with this type of thing, they're also a lot more likely to adhere to what you're suggesting, right? Most people don't like going somewhere where the health professional is telling them, well, just stop doing whatever you're doing for a month, right? That's not what most people want to hear, because, they don't want to stop doing what they're doing and what they love to do. So this is a much, much better approach because it helps the recovery process. It helps the mental health component of being told that you've maybe got to slow down. And, a good example is like what you saw with the concussion in the Leaf game with John Tavares. Like,
right.
He's out there, he's still being active, doing things. And that's really the way that we treat everybody, as if they were a high-level athlete from that perspective, where you still want to keep whatever level of fitness that you can during the time of recovery.
It's interesting, too, because I think another negative to just, as you say, just rest as opposed to active rest and keeping on top of your injury. If you just totally pack it in, whether under your own volition or been told by a professional that doesn't know any better, really, like yourself, the problem is you can get too far down that rabbit hole, and then getting out of it again, you might be like, screw it, I'm not doing it. Now I've been off so long, now I don't have the mental wherewithal to get back on the horse, and that can be deadly as well. So you got to keep your foot in the game to some degree, even when you're resting and treating an injury, right?
Yeah, absolutely, and that's a great point that you bring up. That you want to definitely have that rest, but again, do it in a way that works for the individual. That's still, again, the main goal being that you still want the person to recover, and you can have the rest, but you don't want to have rest where you're doing nothing, because you're absolutely right. It can become a vicious cycle for a lot of people. A lot of people that have tried to achieve some level of fitness know that it's sort of a mindset, right? Like everything's got to be going right. So, and John, you and I are like this. We've talked about it before where, if all of a sudden we're not active, we're not doing the things that we love, it's a lot easier to pick up a bag of chips and eat that at night. It's a lot easier to, have that extra piece of meat at dinner. It can be a very, very vicious cycle because, again, I think that ties in with the mental health aspect too, where all of it is connected, and that is really important. And you're right, you can then start to go down this slope where all of a sudden, months can go by and you sit there thinking like, wow, I've sort of lost all the gains that I have made simply because I was told to sideline. And really that's what you want to avoid. You want to avoid that aspect. And that ties in, again, with that mental health aspect of this all, that you want to still be able to do the things that you need to do and get back to them as soon as possible. And the research, again, around that active rest is very, very good. And that's really what we encourage. Again, the idea of do nothing with injury is a very, very archaic way. Even when you consider something like, let's say, a fracture and you're casted. Okay. Let's say it's your left lower leg, as an example. You got to be in a cast for your left lower leg. Well, that doesn't mean you can't do stuff with other parts of your body, right? Like there is so much, sometimes people will say, well, I really love to run and I try to do interval training because that's what's helped me to lose weight and I run in order to do it. There's other things that we can work on. There's there's ski cables, machines, there's ball slams. There's other ways that you can incorporate that high intensity type of training in a different format. There's a lot of things out there. And that is what you really want to encourage people to do. It's like, okay, we're going to baby your leg. You can't really do much with that. And you've got a, fractured leg, so you're not going to go for a run. But how can we still keep you at the level of fitness that you'd like to be and doing other things? There's lots of options.
Quick break, 416-870-6400, 416-870-6400. That is the number to call here now and ask your questions about your own personal health. Maybe you're trying to battle back from an injury as well and you're not succeeding, or you're going down the wrong path. 416-870-6400, pinpointhealth.ca, the website to go to Dr. Lou's clinics and find one that is active and open, helping people all around your area. Pinpointhealth.ca. We'll continue. Pinpoint Health Show. This is Global News Radio. All right, welcome back here. 1121 Pinpoint Health Show, reaching out to Dr. Lou, 1-855-55 Lou, L-O-U, anytime, info@pinpointhealth.ca. And remember to go to pinpointhealth.ca, the website, for all other links, including social media as well. But here and now, don't be bashful. You have questions. This would be the hour you want to ask about your health. 416-870-6400. Bob, thanks for hanging on. Good morning. Hey, Bob.
Thank you for taking my call.
Sure.
In January, I had surgery on my left knee to remove a large ganglion cyst, and apparently it knocked out my peroneal nerve, so I've ended up with drop foot, and I drive a standard vehicle, so it's a bit difficult. Do you think I'll ever recover?
Well, that's a tough one. I guess my first question would be, have you spoken? Hello? I guess my question is, have you spoken to the surgeon that did the surgery, and what have they said?
Well, I talked to a neurologist. He said it's possible it could recover within a year.
Yeah, nerve health takes a long time to regenerate, if ever at all, and that's a difficult thing. I mean, if the neurologist has recommended that, then the likelihood is that it may be possible. It could take some time. It would also depend on what the type of injury to the nerve was. Obviously, if it was completely severed, then that's not likely. But if it was some type of a contusion or pressure on it, that potentially could recover. I mean, a good example that I tell people with nerve issues is anybody that's ever heard hit their funny bone can appreciate that nerves can sting for a very long time, and that's a quick instant where you have this impact and you get this nerve symptom, and sometimes it can last for like a minute or two from this very quick second. So it can take a long time to recover with something like you have going on. But I would say that your safest bet is to go with the opinions of the people that have actually seen you. And if that's what that they believe could happen, then I would work towards that.
Okay, thank you.
No problem.
Thanks, Bob. Appreciate that. You have any other questions? Want to reach out any further? 1-855-55 Dr. Lou, DRLOU. So what is he mentioned drop foot? What is that?
Yeah, drop foot is the process of, so your foot can dorsiflex and plantar flex, which just means you can bring it up and you can bring it down.
Okay.
And you have different nerves that obviously control those different movements. The peroneal nerve, which controls your foot to go upwards, if there's an issue with it, you can get what's called drop foot, which is the inability to dorsiflex or bring your foot up. And what it causes is this thing called steppage gait, where if you could imagine walking without the ability to lift your foot, you're always just, your foot's sort of landing there, stepping, and creating this type of steppage gait.
Now, you mentioned the nerve thing. Nerves are generally hard and they take time to repair. Is there a reason why that is? I mean, we've often heard that if you have severed nerve in your back, if it's severe enough, you'll be, you can be crippled. You won't be able to walk ever again. But what's the reason for that?
Biology, I guess. That's a evolution, whatever we want to call it. For whatever reason, nerves just don't regenerate well, and we see this with like any spinal cord injuries that you alluded to there, John, where they're working towards trying to figure out a way to regenerate nerves, but it's really very, very difficult, and we don't really know a good way to help them come back sooner. And this is an ongoing issue with these types of nerve injuries. And, one of the risks around surgery, anytime a surgeon's going in, they're obviously very good, and the chances of it are very unlikely. But there is a lot of tissue in the way, and some of that tissue is nerves. And if there's ever a problem, I've also seen people that have had surgery. Following the surgery, they have some type of deficit in that nerve, and then very quickly it recovers. So it very much depends on the individual situation.
416-870-6400, the number to call in, just like Bob. Ask your questions. 416-870-6400, info@pinpointhealth.ca if you want to send an email along. What else you got offering up this morning, pal? Where are we going?
Yeah, so again, we sort of alluded to spine stuff there, and an extreme example being spinal cord injuries, but a much more common issue that happens with the spine is mechanical back pain. Having issues related to muscles, joints, the other soft tissues in that area. Again, I sort of, at the beginning of this show, said that there's an 80% prevalence in the population of low back pain, which essentially means that any given point, 80% of the population could be experiencing back pain, or the other way to look at that is you have an 80% chance of experiencing low back pain at some point in your life. And most people listening to the show are probably saying, yeah, I've experienced it. I've had low back pain. You've had low back pain, John. So it's not something that is uncommon.
So what's the first steps? I mean, if you're suffering for that, which I know there's a large population, and it's planet wide. It's not based on size, race, religion, ethnicity. It's just being a human. What's the first step? I mean, because this can be crippling and debilitating depending on the degree of it. I mean, it's your hinge point, your lower back especially. What's the first steps with treating it? Where do you go?
That's a good question. The first step, I guess, is number one, seeing a professional. That I would say that's the first step, because you've got to figure out not all back pain is equal, and not all back pain is just simple mechanical low back pain. So you've got to make sure that you've got the right diagnosis. If you have mechanical low back pain, the next thing that will happen is it depends on the stage of that back pain. So let's say this is an acute issue. It just happened a few days ago. The approach to that is very, very different than the approach to if you've had low back pain for 10 years.
Yes.
In general, what I can tell you is that in the early stages of low back pain, so acute phases, things that are passive in nature, a lot of the therapies that everyone thinks about, medications, chiropractic manipulation, physiotherapy, massage therapy, osteopathy, whatever it may be. Passive meaning something that someone else can do to you and their particular interventions. Those are much, much better in those acute phases. As you move out of the acute into subacute and chronic, and especially when chronic is anything really over 6 months, but some people have 10 or 15 years of chronic low back pain. As you move towards that side of the spectrum, really the focus needs to be on those professionals helping you with rehabilitation, exercising, strengthening, stretching, all of those things. So it becomes much more what we call active care, which means the stuff that you are going to be educated to do that you then need to do to yourself.
Yeah, I think it's tough to really stress the importance when it comes to active care of how much a participant the actual sufferer of the injury becomes. I know we've talked, many times on the show that we have people where they're given a set of, say, exercises, for lack of a better term, and they may be on board and full of gumption for the first couple of weeks, and then they kind of go, it's feeling better, so I'm just going to lay off. It's taking too much time. I'd rather go do this or go do that. And here they are. They've opened up this cavern of problems because they didn't keep up with the active component, which again is something you don't find athletes doing. That's why they recover so quickly, because they're steadfast in their approach to what you've told them to do on a daily, if not weekly basis, right?
Yeah, absolutely. When it comes to the active care, let's take a step back. The issue is that once someone is diagnosed with low back pain, people have this underlying assumption that low back pain should be completely cured and that you'll never have it again. And that's not the reality. The minute that you experience low back pain, you are almost guaranteed that you're going to keep experiencing low back pain at different points in your life, at different severities, of course. Not everyone ever gets crippling back pain, but it's very likely that it will progress further if the right things are not done. And the issue really becomes that because there's this underlying assumption that, it should just go away and it shouldn't be an issue, and people can't appreciate it, they sort of, the minute that they feel better from the acute problem, they stop doing the things that they need to do. And then, a year later, they might experience it again. A year after that, they experience it, it lasts longer, it's more intense. And you fast forward 10 or 15 years, and these are the people that might be in chronic low back pain every single day. And that often is a function of not having done the proper rehabilitation in the early stages. And so, I could totally appreciate why people feel that way, that, okay, I feel better, so I don't have to do anything. But what I try to tell people is low back pain is analogous to, say, something like diabetes. If you're diagnosed with it, you know that you've got to make lifestyle changes. You've got to change the way you exercise, the way you eat. Maybe you have to be on medication, but it's not necessarily something that will ever absolutely be cured. And even your low back pain, although you may not be feeling it, that doesn't mean that the underlying issue that is the mechanical aspect of the back is ever going to go away completely unless you keep on it. And the only way you keep on it is with the rehabilitation exercises.
That's the way to do it. I'll give you some contact here as we continue on. To reach out to Dr. Lou anytime, info@pinpointhealth.ca. The email 1-855-55 Dr. Lou, DRLOU. That's if you want more of a lengthy private conversation with Dr. Lou or a member of his team. And the clinics, as we say every week, they are open. They are helping people. They're functioning. Don't sit back and let these things fester and get worse. You want to treat it, take it from someone like you or I who's been dealing with 30-plus years of lower back pain on and off. You want to get on top of this thing, man, because it's going to be poking at you forever if you don't treat it, or at least get some active therapy as far as that's concerned. 416-870-6400 is the way to call in for the remainder of the show. You often, especially when it comes to low back pain, Dr. Lou, you often caution people about these, these snake oil fixes and stuff you see on TV as well, right? You got to be really cautious of these things you'll just buy, and it's everybody has with a hammer they can hammer in every single nail, right? You got to be cautious of that stuff too, right?
Absolutely. The miracle cures for low back pain do not exist. I'm just going to be very honest about that. Anybody that's selling you some type of miracle that, hey, if you do this, it'll be gone, that's not what's going to happen. Could it potentially help with a bit of the management of the low back pain that you have? Yeah, potentially. What I see a lot of, and this, I guess we probably have to go to break, and so before I go into that topic, I think let's divert towards the break, and then I'll go into sort of the issue with these gimmicks.
You got it. We'll do that when we pick it up, and, of course, give you some time here, a minute or two, to grab a phone, make a phone call. Don't be bashful. Call in. Would love to talk to you. Live show here at 11:34. Still got some time. 416-870-6400. Pinpoint Health Show, Global News Radio. 11:37 on a Saturday morning. That's a great plan. 416-870-6400. Call us. Get some answers. Don't be in the dark about your health. Dr. Lou here every weekend to answer those questions. 416-870-6400. Donald, thank you so much for hanging on. Had a short break there. How are you this morning?
Not bad. I have spoken to Dr. Lou before. I'm a chiropractor and have had a hip femur fracture, and I have a second fracture. I had a fall right on my kneecap and fractured my patella. So it's pretty painful, but I can walk with it now with a cane, and I have a brace that is a longitudinal brace with the straps 3 above and 3 below the kneecap, and the hole in the brace. I'm not sure what you call this splint, but it's a splint, and it has given me support that I can walk with a cane. What I wondered is, I'm not sure how this fracture was. I know how it happened. I fell directly on a concrete floor, and it very hard, and I caught my foot in the carpet, and I have a fair amount of pain with it from time to time. And now I want to know. I understand I just don't know which way the fracture was, either vertical or horizontal. So I would imagine there's a different way of managing that kind of pain and managing the support.
Yeah. So so if I understand correctly, you're wondering if the orientation of the fracture affects how the pain is perceived?
Well, not how it's perceived, but how it's managed.
Oh, I see. Well, have you seen what has the orthopedic surgeon recommended?
I've not seen him other than the first time. I've just been in hospital for a short period of time. They sent me to physio at Harbor Point, I think it is, near the Don Jail there, where it is in Riverdale. And I was in there for about a week. So this happened 2 weeks ago on the 13th of May.
Right. Yeah, no, I could definitely appreciate what you're going through. I think a lot of it is continuing, in my experience, when we deal with these types of issues at the clinic level. It's really about continuing with the rehabilitation that's being recommended by whoever you're seeing, and over time, as it starts to heal. I mean, the people that have seen you will know better than I would. I don't know enough of the specifics about what the plan of management from the therapy side is, but I would assume it sounds like you're going to a very good place. They would give you the proper recommendations, and a lot of times with these types of issues, it's also a matter of patience. Sometimes these fractures can take some time to heal, and the pain that is associated with it will take some time.
Let's move on. Dr. Lou, 416-870-6400, the way to call in, make that phone call like that, get some quick answers anywhere, at least get started on some answers. 416-870-6400. The patella is a kind of a weird thing. It's just kind of floating there in front of the knee joint, right? Is that a very tough thing to treat generally?
It can be, yeah, for sure. It depends on, a lot of different things, person's age, level of activity, their body type, right, in terms of, some people have more what's called valgus stress on their knees, or some people are heavier set, and so there's more pressure. There's a lot of things, and that's the reality about all different types of injuries. That's why, it's sometimes hard. I mean, I try to do this show where I answer things very, very generally, and the reason why I answer it generally is because I don't know the specifics of the individual and everything that goes around with that. And so the reality is, some of these things can be difficult to treat, and then in other cases they may not be as difficult to treat just because of the way the fracture might be, or the person's level of fitness overall. All of those things matter very, very much. And I think from the perspective, I think what COVID has sort of shown the world is how different people can, succumb to different things. And that's not so unique just with COVID, right? Like, we see that in a lot of different things in healthcare, where for some people a certain thing may not almost affect them at all. And then for other things it could be, life-threatening. We see that with, flus, the regular flu that we're used to, where some people, might be exposed to it. They never even develop one symptom. Other people are exposed to it. They develop some symptoms, and then other people, some very severe symptoms. And some people, unfortunately, even die from that. All stuff in healthcare really works that way. I know people seem to think that it's unique to COVID, but it's not. Different things affect us differently, and that's no different if we broke it down to low back pain, mechanical low back pain. Some people with mechanical low back pain, it's a few times in their lifetime that they experience it. They do something, they feel better, and outside of those few instances, it's not very much. Other people are dealing with it every single day but managing it, and then there's other people that unfortunately can even become severely crippled as a result of it. So this is very much why individualized medicine matters so much. Is the reality is not just the diagnosis, but who the diagnosis is happening to. That healthcare professionals like myself have to take into account is what's the reality of that person. Who is the individual? What are the things that have happened in their life that may predispose to poor prognosis? That's what prognosis is. Prognosis is not. Prognosis is how likely you are to get better from something. And that is very, very individualized because we're all different. We are all different. And that is the simple reality of it.
Let's grab a quick call before we take a short break. Rose, thank you so much for taking the time this morning. How are you?
I'm fine, thank you. Yourself? Great.
What's on your mind?
Well, I've just been trying to figure out for some time, over a year. I have lower back pain, but it goes down to it. I have pain in my top of my legs, but I don't know where it's actually coming from, and it goes up into my back. And when I'm walking, sometimes I don't, like, I feel like I'm almost going to fall, so I have to rest,
Right.
But I am on oxygen right now. I do have a hernia up by my navel, and I don't know what could be causing that, because I do have belly fat, so.
Yeah. So what's sort of your question?
Well, I just wondered what should I be doing? Should I be trying to seek out a specialist, like either a rheumatologist or?
Well, a rheumatologist will deal with back pain that is a result of inflammatory conditions. Most of the time, that's not the case. I would definitely say that you have to seek out a medical opinion that, could be your family doctor, could be a chiropractor that you've seen before, whoever is a primary care provider. But I would start there in terms of a specialist, that is like a rheumatologist or a spine surgeon, probably not needed. Well, I shouldn't say probably not needed, but you're not going to be able to jump to that. That will be one of the primary care professionals will have to identify the potential need for that and then would make that referral if necessary. But I do definitely think that you should get it looked at by a primary care provider for sure, because, again, not all back pain is the same. And the assumption that it's just mechanical may not be the right assumption, but at the same time, you can't assume that it's something else. You've got to get someone to look at it so that they can come up with the right diagnosis, because the diagnosis is what's going to determine what the plan of management will be.
Okay, well, I do have a lot of inflammation in my back because I did go to a chiropractor and he told me. Also, I've lost 3 inches in the last 11 years, and the other thing that I was hitting in the back was an accident, in a grocery store because they didn't see me and they ran into my back. That's a year ago, and I just seem to be getting worse. And I'm very active before, and now it's sort of wearing on everything,
Yeah, no, I understand, and that's unfortunately something that I hear all too often, where people, as a result of their low back pain, start to lose a lot of the things that they used to once do, the mobility and all those things. Again, the reality is it's very hard for me to tell you specifically what you can do over the radio. You've got to get it looked at. Someone's got to make a plan of management. I could tell you that, when it comes to mechanical low back pain, I don't know if that's what you have, but if it is what you have, at this point, really what it needs to be is the strengthening of the spine in order to help the management of the pain. So, there's a lot to look at, and that's my point. That's why you've got to see a professional in order to start to look at that and break it down and give you what the right plan of management should be.
And with that, we'll take a short break. Stand by, Jonathan. You're up next. Hang on the phone. We'll get to whatever it is ails you. Try to answer your question, and you have time as well. 416-870-6400 is the way to call through. PinPoint Health Show, Global News Radio. All right, 11:51, back at it, and back to the phone calls. Always our top priority, our listeners and callers. Jonathan, thank you for standing by for a few minutes. How are you?
I was going to say I'm well, but I guess that isn't entirely true.
Right, what's going on?
Yeah. So I noticed some balding, so I went to my doctor, and he prescribed something called finasteride. He said there could be some side effects, although the chances are low, but once the medication is stopped, that you'll be fine. I took it back in September. I noticed some side effects. I stopped. Then I thought I'd try it again, and I started again April 29th, and I took it for 22 days. And then I noticed those side effects again, like low libido, erectile dysfunction, things of that nature, and then some anxiety as well. So I decided to stop again. I stopped last Friday, so it's been just over a week, and some of these symptoms are, although starting to get better, still persisting. I'm wondering, how long is this going to last? Will it go away? Have I ruined my hormonal balance forever? What's going on?
Yeah, I will simply say I have no idea. That's definitely not something that I don't deal with hair loss and the prescription of those medications, so I don't. I'm not aware of them. I'm not aware of the potential side effects. I would say that the best course of action would be to speak to whoever the prescribing physician was, speak with them about what's going on, get their opinion. That I think would be your best bet. Unfortunately, I can't offer much more in way of that.
But, in relation to what Jonathan's saying, of course, not with his specific situation, but I mean, you can take what he's experiencing, take that over to say, a low back or a knee or with something that's been prescribed to you, either medication or physiotherapy. I mean, once you're on the program or taking said medication, if you do suffer adverse effects, probably doing what he did is probably the thing to do. Maybe back off and wait and consult someone like yourself or who prescribed it, even if it's a physical activity or some sort of physiotherapy. And say, this may be helping in one regard, but I'm having some pretty bad effects as a result of starting this program, right? You should back off and wait and get another opinion, correct?
Well, and it may not need to be another opinion, but at the very least, the opinion of the person who is working with you. And you bring up the example, and we'll focus on the therapy side because that's more of my world. Yep. Absolutely. We see lots of people that you might be treating for a sprained ankle, as an example. You're treating them for that sprained ankle. And, there are every single intervention, health intervention, can have a potential side effect, right? Some of them are very mild and not bad at all. In the rehab world, in the physical therapy rehab world, most side effects are very, very mild. But the reality is that they still could potentially exist. And one of the things that I try to consistently get across, even on this show, is have the lines of communication open with whomever the professional is. And I tell patients this too when I see them. You're going to get treatment for this, but make sure you're telling the reality to the person that's doing the treatment. So if you're not feeling better, the reality is sometimes you develop relationships with people and you might be seeing a therapist and you really like them as a person. You get along from a human perspective. And so you may not want to tell them the truth that, hey, actually, I'm not feeling better, because you think it might hurt their feelings. You might be insulting them. But that's not what the professional actually cares about. What they actually care about is making sure that you, the patient, are getting better. And the only way to know that is through honest communication. And that communication has to go both ways. And I tell my patients that I need to hear the reality of their experience. And I'm also going to give them the reality as well, so that if I think, like, as an example, they're not doing the stuff that they should be doing, then I'm going to call them out on it. But it's got to be an open, respectful dialogue. That's how people get better, because the treating professional, it doesn't matter what the intervention is, has to know how it's affecting you, the individual. They can't possibly know that without being told that back by you.
And it's interesting. You also got to factor, and you've mentioned this on the show as well, there's that, that hurt versus help versus harm type of thing where, and we liken it to going to the gym and lifting weights. Yeah, the first couple times you squat or do some exercises, like next 2 days, like, wow, I'm sore. That's good. You're supposed to be, because you just worked a muscle. And there's some of that as well with physiotherapy as well. I want to try to get Tim in here quickly. Hi, Tim. What say you?
Hi, guys. With the caller that just phoned in about that hair loss problem.
Yeah.
And experiencing low libido. It may not have been the fact that that medication that he was on. More or less, it's probably the fact of what his testosterone count is. And I would be going back to his administering GP and getting a total testosterone count done through blood work and kind of seeing where he's in with that if he's experiencing libido issues.
Yeah, it's a good call. Maybe something like that would be. Hair loss, kind of know that pretty well. But there you go, right? Final words, pal. I got about a minute before we wrap it up.
I thought there was an actual point to that. So that is one of those dangerous things what just happened. That's one of the things that I'm always hesitant of on, like, even when people talk to other people, where everyone believes that they, because of their experience or whatever, that they know, and I'm not necessarily suggesting that caller's advice was necessarily bad advice, but I think what it was is there shouldn't be assumptions made. And that's why I don't throw them out anywhere. It really does come down to go back to the treating professional, go back to your family doctor, whoever your primary care is, and tell them. They'll know what to do. They often don't need to be told what to do. So, that's, we as healthcare professionals, we deal with this all the time where people come in and say, well, so-and-so who's my friend or my uncle or my aunt or whomever it may be, told me that this is what I should do. And it's like, well, sometimes you've got to leave that stuff up to the professionals. And I think the messaging around going back to the treating professional is absolutely the right thing. But assuming what it could or could not be, that's a different question. But anyhow, but yeah, I mean that ties into sort of the final words that I would do for this show today is that at the end of the day, it's got to be individualized. You've got to get yourself checked out by the professionals. Make sure that you're communicating honestly with them, giving them the reality of your issue. If they have to see you again, you've got to give them the reality, the follow-up. Are you doing better? Are you doing worse? But, again, one thing that I've said for 5 years on the show, you've got to have the right diagnosis. A professional does that. Once you have the right diagnosis, that is what's going to determine what the treatment plan, what the plan of management is. And that is the right way to go about it. Most people, I shouldn't say most people, but one of the issues that we see is most people start in reverse, where they just start with the treatment. And you're going backwards in that regard, in my opinion. What you should be doing is starting from the diagnosis and then moving towards plan of management.
And we'll leave it there for another week. Reaching out now that we're done off air, no problem. 1-855-55 Dr. Lou, DRLOU, Dr. Lou. Oh, I mentioned as well the long form podcast series, the Lou Down. Wherever you get your favorite podcasts, you should check that out as well. Some really cool stuff there. And PinPointHealth.ca is the website to book and find a clinic that is open and helping people right now, and info at pinpointhealth.ca as well. We'll catch you next weekend. It's Pinpoint Health Show, Global News Radio.
The preceding program is a specialty program. Unless otherwise identified, the participants on the program are not employees of Chorus Entertainment. Opinions expressed may not necessarily reflect the views and policies of Global News Radio 640 Toronto.